So yeah, I'm Steve Graham. I work at the University of Melbourne in Australia, and for many years I've been, since 2006, providing technical assistance to the union in the area of particularly child and adolescent tuberculosis, and I'm also now a board member of the union. Well, there's a challenge in trying to address the challenges of child and adolescent TB. We have a major problem with under-detection of cases, and most of the deaths that happen are in young children under 5 with TB who are never diagnosed. And I think our focus is really on reducing child mortality and also preventing cases through tuberculosis preventive therapy. And by sitting at a tertiary hospital and a big teaching hospital, we're not going to be able to achieve that, because there's a big issue of access and equity to care. And what we need to do is strengthen the ability of healthcare workers at the secondary and primary care and into the community levels to be able to detect the cases for TB, get them onto treatment, and to provide preventive treatment in the household contact situation. And all of this can be readily done by healthcare workers at those levels if they are able to have enabled with the confidence to be able to make the diagnosis and understand that actually child TB is usually fairly straightforward. Most children don't need to be referred to big tertiary centres, and so that's an opportunity to improve case detection, get more children onto TB treatment, reduce the amounts of deaths, and prevent a lot of TB. Yeah, I think it's the fact that you realise that people have been yearning for this opportunity to gain knowledge in this area for a very long time, and to be able to see people attend the course feeling a little bit fearful of child TB, a little bit lacking in confidence, that it's very difficult, and then to go away from the course feeling very confident and feeling that there's a whole network of people out there who can support this. I think that's the most satisfying, yes, because it leads to action in the field. Yeah. I think it's the fact that from a number of these courses, we've seen the development of national champions and national child TB leadership, often paediatricians, not always paediatricians, but people who work in maternal child health, then start working with the national TB programs to be able to address these big policy practice gaps that we have.